This is Chapter 5, Infertility, Contraception, and Abortion for NUR 202. Your objectives for this chapter are to list the common causes of infertility, discuss the psychological impact of infertility, discuss common diagnosis and treatments of infertility, compare reproductive alternatives for couples experiencing infertility, explain common nursing interventions that facilitate contraceptive use, and recognize ethical, legal, cultural, and religious considerations of infertility, contraception, and elective abortion. Most of these we will touch on a little bit in this chapter, but most of this is going to be for you to read on your own. There's very little testing material from this chapter. The incidence affects about 10 to 15% of the reproductive age couples. Infertility refers to couples who have not conceived after 1 full year of trying regular unprotected sex when the woman is less than 35 years of age, and after 6 months when the woman is older than 35. You can see here there are 4 goals when providing care. That's to provide the couple with accurate information. That's very important. People like to be informed. Assist in identifying the cause of infertility. Promote emotional support and guide and educate about forms of treatment. Assessment of female infertility. Both being obese and being underweight can contribute to anovulation disorders where the woman does not ovulate. Signs and symptoms of androgen excess, such as excess body hair and pigmentation changes in the skin, should be noted. A past history of STIs could mean tubal patency impairment, and some women have abnormal uterus formation that happened during her own fetal development that she may not be aware of until she goes to an infertility specialist. Lab tests to check the normal hormone levels would be done, and you can see page 98, box 5.4 for more about female infertility. This picture is a picture of an abnormal uterus. Picture A is a complete bicornuate uterus with the vagina divided into a septum. So in picture A, the vagina and the uterus are both divided into 2 separate entities. Picture B, complete bicornuate uterus with a normal vagina, so she has a single vagina, but the uterus is split in 2. C is a partial bicornuate uterus with a normal vagina, and D, she has an abnormal uterus, which means it's very much smaller than a normal size uterus would be. Assessment of the male infertility will be on page 98, box 5.2. They're going to check for hormonal factors, testicular problems, factors associated with sperm transport, and idiopathic male infertility. This picture is from surgical therapies that you'll see on page 101. This is a hysterosalpingography. Note that the contrast medium flows through the intrauterine cannula and out through the uterine tube. Scar tissue adhesions may cover over the ovary or obstruct the fallopian tube, and then this surgery would be necessary. Care management included with assessment of female infertility. You can also see on page 98, box 5.4. Test or examination, evaluation of the anatomy, detection of ovulation. Is she ovulating or not? Hormone analysis, ultrasound, endometrial biopsy, the hysterosalpingography with laparoscopy. An assessment of the male infertility would include semen analysis, hormone analysis, and scrotal ultrasound. The plan of care and implementation. Medical therapies would include infertility medication. See page 102. Clomiphene citrate, or Clomid, commonly known as, is the drug of choice to produce multiple ovum. There is, of course, an increased risk of twins or higher multiples when using this drug, and that's considered something that some people do not want to go through, to have triplets or quadruplets or a litter. Medical therapy and surgical therapies, like assisted reproductive therapies, you can see on another page. This is a laparoscopy, page 101. If you don't know how this is done, you might want to read up on that. They're doing this kind of surgery a lot more than they used to. Assisted reproductive therapies, there are many of them. The in vitro fertilization, embryo transfer, the gamete intrafallopian transfer gift, and you can read about all of these in your book. In vitro fertilization is done through laparoscopy. A ripe follicle is located and fluid containing the egg is removed. Then the sperm and the egg are placed separately in the uterine tube where fertilization will occur. Pre-implantation genetic diagnosis is a form of early genetic testing designed to allow identification of embryos with serious genetic abnormalities. This gives the woman the opportunity to terminate the pregnancy, knowing that the fetus is not going to produce a normal, viable baby. See the legal tip box on page 103 about cryopreservation. This is a couple who decided to do a foreign adoption after she had 2 miscarriages, and that's done frequently apparently. Contraception. The best thing to remember about contraception is that the best form of contraception is one that both the man and the woman can agree upon and comply with. It takes 2 to make a baby, and it also takes 2 to prevent making a baby. Intentional prevention of pregnancy is what contraception is, and birth control is a device or practice to decrease the risk of conceiving. Family planning is the conscious decision on when to conceive or avoid pregnancy. It's still considered a risky thing for some women because estrogen, now predisposes us to having more breast cancer. So it's something that we need to really take a look at what's best for us in our life. A multidisciplinary approach to assist a woman in choosing an appropriate contraceptive method is necessary. And ideally, the method should be safe, readily available, economical, acceptable, and simple to use. Contraceptive choice must meet personal, social, cultural, and interpersonal needs. The good old coitus interruptus, or the withdrawal method. Some people swear by this, but it only takes one little sperm, and some of them are really good swimmers, so anything could happen. Fertility awareness methods, you can see on page 106. Most of these kind of methods only work if the woman has a regular 24 to 28 day cycle. These are called cycle beads. If you look on page 107, you can read about this. It's under the standard day method. And there are many of them. FAMs, the standard days method, basal body temperature method, cervical mucus ovulation detection method, and so on, breastfeeding is not, I repeat, not a good form of birth control. Back in the days when people were just replenishing this country with people, they thought that if they were breastfeeding, like really breastfeeding every 2 hours continuously for the first year of life, that they could not get pregnant. That's not true. A woman who's breastfeeding may not have a period for a very long time, but she may still be ovulating. If she is ovulating, then she can get pregnant. And that was seen in many cases when there was a family of 10 children. Obviously, something was not working. This is the recording the basal body temperature special thermometer and a chart. It's very time consuming. You'd have to be very dedicated to do one of these birth control methods. You can see this on page 108 in the guidelines box. And also this is on 108. It's a picture of a completed symptothermal chart. Ovulation predictors can be bought in the drugstore department of any stores, drugstores, Walmarts. If you want to see when you're ovulating, so if you're planning to try to get pregnant or you're planning not to, then if you're ovulating, you take it from there. Barrier methods would include your spermicides, your condoms, and there is a male condom and a female condom called a vaginal sheath. There are diaphragms, cervical caps, and contraceptive sponges. Here's some examples of your spermicides. On the left you have the female condom. In the middle is your female cap. And then you have these spongy things, the female contraceptive sponge on the right. Hormonal methods: combined estrogen, progestin contraceptives, oral contraceptives, and side effects. They have the patch transdermal contraceptive system, which you need to remember should be placed below the waistline, and vaginal ring. Not sure how that one works, but this is taking the pill. And what happens if she misses a pill? Can you say oopsie? Not a very good plan if you're not trying to get pregnant. Hormonal methods like progestin-only contraceptives are your oral progestins like the mini pill, injectable progestins like Depo shots, those are only given once every 3 months, and implantable progestins like the Norplant and others I can't call the name of right this minute, sorry. Emergency contraception used within 72 hours of unprotected intercourse. 5 methods available in the United States. They're high doses of estrogen, and there's 3 options. 2 days of levonorgestrel, insertion of the copper uterine device, your IUDs, very popular in this country. The IUD is a T-shaped device wrapped in copper that's inserted into the uterine cavity. Medicated intrauterine system loaded with progestinal agent. The Mirena is an example of one of those. The IUD offers no protection against STIs or HIV. And this is a picture on the left of the copper T380A. And then B is the levonorgestrel releasing intrauterine device. Sterilization for the female would include tubal occlusion or tubal reconstruction. and in the male, tubal reconstruction, and that can be reanastomosed maybe 1 or 2 times, but after that it puts the man at high risk of possible scarring that creates cancer. He don't want to go there. This is just a picture of where they cut the tubes. That picture actually at the top shows where the tubes are cut and tied. I don't think they really do that procedure so much anymore. When they cut them so that they're far enough apart that they could never grow back together. A few years back, when I first started doing this surgery, women would have their tubes literally looped and tied, not cut, and they would somehow get back together, and then 10 years down the road, when she thought she couldn't have any more babies, she had a surprise. She was pregnant. So they pretty much sever those tubes now. This is the use of a mini laparotomy to gain access to the uterine tubes for occlusion procedures. Abortion, also used in conjunction with the same word as miscarriage. Purposeful interruption of pregnancy before 20 weeks of gestation. It could be elective or it can be therapeutic. There are usually contributing factors, and you can read up if you want to on the legal and moral issues. The Roe versus Wade in 1973 is a big famous case about abortion. First trimester abortion is usually a surgical aspiration abortion. Medical abortion, they use methotrexate and misoprostol, and mifepristone and misoprostol medically will cause you to miscarriage. Second trimester abortions are much more dangerous, but if they are doing one, they'll use a dilation and evacuation. It's still a suction procedure. We know that the heartbeat starts at about 21 days of age. 12 weeks is the first trimester. First trimester abortions, the baby could still be having a heartbeat. Everything is formed by 10 weeks. It is a baby. It has a heartbeat. But in second trimester, they just vacuum it out. Cervical preparation with prostaglandins and emotional considerations. It's not an easy thing, and a lot of women have regrets in their later years that they opted to have an abortion. Induced abortion performed in the first trimester is the safest and less complex. Common complications, of course, would be infection. Retained products of conception, that means that they caused an abortion, but some pieces maybe of the placenta were left inside, and that can cause more infection and excessive vaginal bleeding and possible hemorrhage. Your question says a physician prescribes Clomid for a woman experiencing infertility. She is very concerned about the risk of multiple births. The nurse's most appropriate response is A. This is a legitimate concern. Would you like to discuss this further before your treatment begins? Or B. No one has ever had more than triplets with Clomid. Or C. Ovulation will be monitored with ultrasound, so this will not happen. Or D. 10% is a very low risk, so you don't need to worry about too much. And, of course, the answer would be A. If she wants to talk further about it, she certainly has that prerogative. This concludes this slide presentation. Thank you.